The basic idea is that there's a sensor in the stomach which detects when the patient eats or drinks. And this sensor gives the information to a pacemaker system, and the pacemaker system stimulates the stomach. We know that this changes the gastric emptying, so this slows down gastric emptying, and there are probably a lot more effects which are transmitted from the stomach via nerves to the brain. A lot of things we do not really know which happen, but one thing is for sure, the gastric emptying is delayed. That's the basic idea. When we bariatric surgeons talk to our colleagues, internists, diabetologists, they always are afraid that we cut the stomach apart, remove parts of the healthy parts of the patient's body. This system does not remove anything, and it's more or less a system to change the patient's behavior. And this is what all the internists or the psychologists say they need. They want change in behavior, and that's what the system does. In the first two studies which were performed with the system, more than 60 patients were treated with the system. And we have experience for more than 2.5 years right now with the system. We were very surprised that we saw more weight loss than we initially expected. It's definitely not the case that this system is a system where every patient loses as much weight as he wants. It changes the patient's behavior, so the patient can also behave wrong. But it's definitely a system which fits very well into the variety of bariatric procedures available. We have seen weight loss of more than 70 kilograms in some of our patients, which is enormously, and it always depends on the way the patient goes. So if the patient behaves well, if he works well with the system, I'm pretty sure that on the long run this is pretty helpful. And it's definitely a very safe procedure. So the patients do not have to be afraid that this system does any harm to them.